my goodness. So, Seven Rivers Region Chapter of Credit Unions. Thank you, ladies. And they are manning, we're in really good hands, the Blood Center of Wisconsin phone banks. And Kelly Nickelotti is with us. Lorenzo is here. Logan's here. And Kelly, you're the one that organized our volunteers for our phone banks this morning.
I did.
So you have two hats on. Actually, more than two hats. But thank you for doing that.
Yep, no problem.
Now, last year, you also were involved.
Correct. I was on the phone bank last year.
Nice. So 2 years in a row. It didn't take much to get volunteers, did it?
No.
Because people want to be here. Thank you, ladies. We appreciate you so much. Our number is 784-KIDS, 784-5437. And in our conversation that we've had the last few minutes, first of all, congratulations. Another baby on the way.
Thank you.
January?
Yep, January 24th.
Okay. Now, Logan, what month was Logan actually due in?
In March.
In March. What month was Logan born in?
January.
Okay. So, probably didn't see that coming.
No.
Can you take us back to can we talk about your pregnancy and how things went?
Sure. Everything was going great. I was at work on a Friday afternoon, and I just started feeling a little bit of hip pain. It was uncomfortable to sit in my chair, so I was like, gosh, I think I'm just going to go home and lie down. Mm-hmm. So as all of us first-time mothers and experts do, we go straight to Google for medical advice. I was just Googling, third trimester hip pain to see what I could do to relieve it. And it said to try prenatal massage. In hindsight, that probably wasn't a great idea because I guess that brings on labor.
Oh, okay.
So as I was going up there, I'm like, gosh, this pain is getting a little worse, and it seems to be happening every 5 minutes. I went through with my massage, and I started texting one of my RN friends, and she told me to go in.
Okay.
So I called a wonderful nurse named Michelle, and she wanted me to come in too. And I thought, gosh, we have a tax appointment back in Coon Valley at 5 o'clock. Maybe I should just go to that first.
Of course. Let's do our book work first. Yeah.
My husband convinced me to go in, so I did. And they hooked me up to the machines to measure if you were actually having contractions or not. And they determined, okay, here's the scoop. You are in preterm labor. He was in New York.
Not even anywhere close. And you know what? You didn't even have his baby shower yet, did you?
No.
So he came before his baby shower. So you're all alone. Okay, how did you get to the hospital?
Oh, I drove there.
Oh.
I was already in town because I got my massage. So
Okay. Okay. You had to be. I can see it in your eyes. You were scared to death?
Yeah, I was. I haven't really told the story publicly, so.
Okay, well, let's just take our time with it, okay? And then, we'll just do what we can do. So you're coming into the hospital, and everybody, your family is around. However, they're not thinking they're going to hear this kind of news because they're thinking this is months off.
My parents live 8 hours away as well.
Okay.
But his were there, and they're wonderful, so they were there with me.
Okay, so when did Lorenzo get to your side? It took some time? Was it the next day?
Yeah.
The next day. Okay. So you're admitted into the hospital, and you're by yourself. You have Lorenzo's mom and dad
Yes.
with you.
I texted them. I thought, I'm just letting you guys know. Don't go too far. Go out to dinner with friends or anything. I am in the hospital. Here's what's going on. And they came right away.
Okay. So you just don't know what's going to be happening next. Okay.
Correct.
So when did Logan come into this world?
So it was about 6 hours later. I went in at 5, and he was born at 11:48 after 2 bags of magnesium to try to stop it.
And how much did he weigh when he was born?
3 pounds, 12 ounces, which was good. They did an ultrasound when I was, in labor and stuff to see kind of where we were at. And I was pleasantly surprised. They guessed he'd be 314, I think. And I'm thinking, okay, babies come earlier than this. They're smaller than this. This is going to be okay. And it was.
So when he was born, was there critical issues going on? Was there scary things? How was his health?
He came out screaming, so that was a relief.
That's good.
And the worst part is that they take him right away, and then you're left there. You just delivered and you're emotional and you don't have your baby.
So can you tell me what Billy lights are? Because he was under Billy lights, and I'm not sure what that means.
Yep, he had a CPAP machine to help him breathe right away. He was under Billy lights for, was it a couple weeks? Kind of on and off? Okay. And
Seems like a couple weeks.
yeah. So those, it's kind of like UV lights just to bring your Billy ribbon level up from jaundice being yellowing of the skin. So
it sounds like you guys got a really quick education on preemie
yeah,
situations.
everyone's wonderful. You know, I kind of feel like looking back, it was a blessing because we had every doctor at our disposal, every expert that we could possibly need right there to ask any question that we had. So we learned a lot as first-time parents. It was kind of great.
Let's move forward now. You have got a little charmer here.
Yeah.
Because, well, this is nap time.
Yeah,
and
it
we
is
can
nap
all
time.
understand nap time, and there's 2 teeth coming in. So, I mean, we totally understand this. But he has that charming smile. And to look at him right now, I'm thinking it looks like Logan came into this world full term. I mean, you wouldn't know a thing. Dad, you can get up and walk. You can do whatever you want to do. It doesn't bother us a bit. It looks like, you know, he was born like every other. You guys have gone through a lot.
Yeah, he had his 6-month adjusted age because he's 9 months today, but he had his NICU follow-up appointments, and he's in the 86th percentile for, you know, babies that would be, you know, the adjusted age. So he's doing really well. He's just barely on the chart for someone compared, you know, to what he is actually in the 3rd percentile. So we have a little bit of growing to do, but developmentally, I mean, he's crawling, he has 2 teeth now, he's eating solids, and we couldn't be happier. He's really never been sick since the hospital.
What do you say we throw a number out? He's 9 months old.
Yep.
Let's ask for 9 calls. Oh, we got to ask for more. We already have 9 calls. I just see the update. 784-KIDS, 784-5437. Because, you know, it's Friday morning. It's a little early. People are just, and I thought, well, let's start with 9 calls. So now we're going to go with 15. Does that sound good? Is that a good number for you guys? And we can do it because we have the Seven Rivers Region chapter of Credit Union gals ready to answer the phone. So what you guys were going to do today, I understand, you were going to do like a double thing. You were coming here first, and then you were going to have your 9-month doctor checkup with Dr. Kelly Barr, who happens to be like one of your favorite physicians of all time.
Yeah, she's great.
Okay. And you got a call. She can't see you today. So,
No.
So you're going to wait. You're going to wait and go see her. Okay. What makes Dr. Kelly Barr so wonderful?
She's kind of a straight shooter, and she tells it like it is, and she doesn't sugarcoat anything. So, you know, she was not on call the night that Logan was born, but she made a point to come to the hospital and see us on a Sunday to see how we were doing and explain why she couldn't make it. And she just really cares about her patients. So I love her.
I can see that, and I can hear that. Lorenzo said the same thing.
Yeah.
Because you were doing a quick diaper change before our interview started, and I said, if I asked Kelly what her favorite doctor, who it would be, I said, would she say Dr. Kelly Barr? And he said, yes, she will.
She's got a good name, too.
Yeah, absolutely. Great care. So what we're going to do is get these phones ringing at 784-KIDS, 784-5437. That's the number to call. And today we'd love to thank Hot Spring Spas and Pools. Melissa, Casey, Dawn, Amanda, they're our daily title sponsor, and they're one of the companies that have been with us since almost day one, too. Because what happens here is we end up having a great big family, and we have businesses and we have individuals that want to be involved every year because they love kids. They love kids, and they want to help the families. Now, what did Children's Miracle Network hospitals do for you when you guys, well, Logan was here for a month?
Yeah, so he was in for 30 days, and we live out in Coon Valley, so it's a bit of a drive every day. I mean, everything is kind of put on hold, and we were fortunate enough that we were able to come to the hospital every day. You know, we would have a routine, just like somebody going into work.
Right.
And so they gave us, you know, a gas card so that we could, you know, not have to worry about those extra expenses when we weren't working. And the biggest thing, I think, was the meal cards. Early
you kind
on,
of forget to take care of yourself, don't
yeah.
you?
So early on, we were just maybe trying to pack a cooler and throw it in the fridge in the break room because you don't want to leave the unit. You're just so worried all the time, and you honestly forget to feed yourself. And so when we were told that those were offered and they started giving us, vouchers for the cafeteria every day, that was like our little break. Okay, we can kind of regroup our minds and step off the unit and go down and enjoy lunch together. So that was really helpful.
We had another call come in. We're up to 10. We're going to shoot for 15. I'm going to update you as we go.
Okay.
How would that be? 784-KIDS, 784-5437. Waiting for your call this morning for our little Logan. Where did Logan go? Did Logan do the handoff? Oh, Ashley.
Actually, he looks happy now.
Yeah, he does.
He's a little flirt.
Really happy. So another baby on the way.
Yes.
How are things going?
So far, so good.
Okay.
I'm on a McKenna shot, so once a week, in your butt.
I don't know what that is.
It is extra progesterone that is just supposed to prolong the pregnancy, and so they'll have started me on 16 weeks, and they'll have me on that until I'm 36 weeks.
Okay. You're getting there.
Yeah, I'm 26 now,
Yeah.
so still haven't surpassed Logan's, going for shooting past 31, I'm hoping.
Lorenzo, you kind of sticking close to home this time around? Okay.
He said he's not missing this one.
Okay, but you have a trucking company.
Yes.
And you got to go places. So, the timing just was not, you can't predict this,
Yeah, things have changed with the business too. We have 3 employees now, whereas it was just him at that time. So we have a little bit more flexibility as far as scheduling goes, that we can kind of take a break and
So
keep him home.
I've been updating you guys on a number of calls. Now I'm going to update you on where Logan is. Now John has Logan. So I just want to let you know where your little guy is because he seems to be making the rounds. Just let you know. He's doing great. Oh, he's waving at you right now. Yeah, John Stevenson has him right now.
He likes to
So
blow
our
kisses.
number is 784-KIDS and 784-5437. And we will get those calls in. We will get those donations in. Have you had a chance, and probably not because you're super busy, but have you had a chance to look at our online auction items that we have?
I actually have, and I was eyeing up the
Did you do
Rudolph
a
the
little
Red-Nosed
shopping?
Reindeer musical. I thought that would be fun to take him to.
Oh, that would be. So did you place your bid?
I haven't yet, no.
Okay.
I
So
don't think it was open when I looked.
Okay, well, here's the strategy. Okay, you can do one of two things. You can bid and watch often, or you can wait till tomorrow and wait in the weeds and try to spring up right at the last minute.
That's usually
However,
the best strategy.
Well, yes and no, because we have had disappointments because so many people are doing the same thing. You got to make sure your bid gets in on time. See, so that strategy sometimes is the way to go and sometimes not. But we don't want you to miss out because if that's your item, we certainly don't want anybody else making any other bids on that. See, we like this healthy competition. We were talking about healthy competition. Now, last year, one of your goals with the phone bank, tell us about that.
Well, as the Seven Rivers chapter, working in credit unions, I guess some of us are a little competitive. And
Are you ladies competitive? Yes. Okay.
we wanted
Just checking.
we wanted to raise the most money more than anybody else during their hour on the phone bank. So we made that a goal. We did a lot of networking, reached out to friends and family, and at that point, we had raised the most that day. So I don't know what the final numbers ended up being, but
Well, they were great.
yeah.
So what we're going to do right now is we're going to let you guys get on with your day because it sounds like you're going to meet up with mom and dad somewhere, maybe a little shopping going on. That's what your husband tells me anyway. So that sounds like a good thing. Thank you for coming in. Oh, okay. Oh, see, that is so sweet. And you guys coming in and sharing your story. It's the first time you talked about it.
Yeah.
It takes you back, doesn't it?
Yeah.
It takes you back to the surprises. It takes you back to the emotions. You worked your way through it, you guys. Thank you for doing that.
Thank you.
Maybe it'll get a little easier the next time.
I'm hoping
Maybe
so.
it will. But we thank you for getting outside your comfort zone because it's the only way that we can share your story is by listening to you guys. Thank you for coming in.
Thank you.
You're listening to the Children's Miracle Network Hospital's Radiothon, a service of the La Crosse Media Group.